Before a loved one leaves a hospital or nursing home, you should be on your way to better health. But an exclusive 5 on Your Side investigation uncovered local institutions shoving patients out the door with nowhere to go. Investigator Sarah Buttison is here to reveal what she found.
Hospitals and nursing homes have a legal obligation to make sure you're in good shape and have a safe place to go when they let you go. But we found that's not always the case in Northeast Ohio. For 14 years, Sheila Williams lived with her sister Edna.
We got along just fine. We really got along.
They were the best of friends.
Until she collapsed January 5th in their Oberlin apartment.
She came in here and sat down over there. And I guess when she tried to get up, she just passed out. She fell on the floor.
And her heart stopped.
Sheila's youngest sister, Rosemarie, says it happened less than 2 hours after Sheila was discharged from the Cleveland Clinic.
And I personally saw her tell the nurse that she had headache, dizziness, and nausea. We don't think that she needed to die.
A spokesperson for the Cleveland Clinic declined to talk on camera or give us a statement, but insisted that hospital staff here at the clinic didn't make any mistakes when they discharged Sheila 24 hours after she got a hysterectomy. Because of privacy laws, they couldn't tell us much more. What we did find out, her family's complaint isn't unique.
I think it's something that just happens.
Mark Lehman works at Metro Health Medical Center and runs a Cuyahoga County committee committed to stopping medically dangerous discharges.
It's down to that point where the resources just aren't out there that we need.
Dangerous discharges are a problem at Ohio nursing homes too.
The biggest number of complaints we get are related to discharge, inappropriate discharge.
Susan Griffin is one of 12 regional long-term care ombudsmen. Her office investigates nursing home complaints.
It's not like they're not aware of how to, I mean, it's law too. How you do it is set forth in Ohio Revised Code.
State violations usually involve issues like failing to tell a patient he's been kicked out of a nursing home. Can be as odd as illegally transferring 2 patients having an affair, and can be as serious as what happened at Project Hope for the Homeless in 2010.
This is supposed to be where we welcome people in. And so it was quite a tragedy that evening for the people who were coming in for the night.
A sick nursing home patient was left at the homeless shelter's door.
The person did arrive on site before the shelter was, before we actually checked in for the evening. And the person had a massive heart attack and did die.
Director Judy Burr's staff had told the nursing home not to send the patient.
It's not easy when you lose a life, especially, you know, due to something that could have been prevented.
A total of 8 homeless shelters in Northeast Ohio told us nursing homes and hospitals have dropped seriously ill patients at their doors within the last few years.
When we get those cases, they're difficult.
The biggest problem is at the state's biggest shelter.
We did have a person that had a heart surgery and a person that had a gastric bypass, and they came fairly soon after their surgery.
Director Michael Saring says about 50 patients a year are dropped off at 2100 Lakeside Men's Shelter in Cleveland who have no business being there. That includes patients with open wounds and fresh stitches.
I know about a year ago we had a hospital van pull up and had a guy dropped off here, and he was still in his hospital gown.
Michael is on Mark Lehman's Dangerous Discharge Committee. They say the numbers have dropped since they started working on the issue.
We asked the shelters, any bad discharges this month? They say none, 1, 2.
That's little comfort to Sheila's sisters.
We feel pretty messed around all the way around.
They never imagined her discharge from the hospital would be followed by her funeral.
It's beyond our comprehension that they weren't as caring as she was.
There's not a lot of incentives for hospitals and nursing homes to follow discharge laws. Some sources for this story say they rarely report violations to the state health department because it's easier to work with a facility than to get them in trouble. And the consequences of breaking those discharge laws aren't serious. A federal spokesperson says hospitals usually only have to submit a plan of corrective action. On Your Side, I'm investigator Sarah Buttison, News Channel 5.